What is arthroscopic shoulder surgery like?
Well, arthroscopic shoulder surgery is what we call minimally invasive. You know, the history of shoulder surgery has been big open incisions around the shoulder, and you have to kind of move all the muscles out of the way in order to see inside. Well, the problem with that is there's a lot of trauma to the shoulder and can really cause a lot of damage before you ever get to the real problem. And so arthroscopic is done totally different. We try to make minimal incisions, very small nicks in the skin.
And then how big?
Oh, usually less than 1/4 of an inch.
So it's really small.
It's very small.
How many? 2, 3, 8?
Usually about 3 to 4 little nicks in the skin, and then we put the camera inside the shoulder, and we fill the inside of the shoulder full of saline, which is basically water with salt in it.
Now, when you put a camera in, Paul, is that like a fiber optic, or
Yes.
is it a big camera?
No, it's very small. It's actually smaller than a pencil, and so it's fiber optic, exactly right.
Can that camera wiggle around so you know exactly where you are?
That camera can move all around, and you can move it to the front, the back, and so you can see the shoulder so much better with the arthroscope than you can if you have to make those big incisions.
And the saline opens it up even bigger so you really know where you are. Then what?
Then we use instruments in order to do the repair work. And I describe it to patients like fixing or creating a ship in a bottle. You know, we're using small instruments through teeny holes in order to do repair work on the inside.
When you do that, it's obviously less trauma to the person. There's 4 muscles. You know which one? Do you know pretty much every shoulder different?
Every shoulder is a little different, but the general anatomy is the same on everybody. All the tears are different. Every tear I see is a little different than the next one, but all the anatomy is pretty similar.
Now, I'm going to ask you what a complete tear, how you fix that in a minute, but what happens if there's just little tears in the muscle group? How do you fix that?
Well, if they're real small tears, sometimes we don't have to fix it. In fact, if it's small, then sometimes just cleaning up the torn edges is all the patient needs to become symptom-free, and that's a much easier recovery if that indeed is the case.
If there's a complete tear of one of those tendons of the 4 muscles, muscles have a tendon, they insert into the shoulder. If you tear one completely, how do you fix it?
So what we do is we prepare the bone. The tendon attaches to the bone, right? So we prepare the bone and we roughen up the bone with little instruments, and then we put small screws into the bone. They're little teeny 5mm screws. They have some sutures attached to them though, and so then we can weave those sutures through the tendon, tie everything down, and that secures everything down to the bone.
So how big are the sutures? You tie it down. Are they little mini sutures? Do they stay there? Do they melt away on them by themselves?
They're very small, but they're also incredibly strong. In fact, I can pull them as hard as I can, and I can't break them, even though they're very, very small, and so they don't create a lot of problems inside the joint. Do they ever go away? Probably not. They stay there, but the body just heals around it, and you know, if we ever had to go back, you'd have a hard time ever finding them.
So you fix that tear, you suture it together to the screw that you've got in there, and you've fixed it. So then can I go out and play baseball the next day?
Next day, maybe not, but eventually, yes.
And the recovery is much better than if you had to do the real big old surgery.
It's so much better, Dr. Bob. It is easier, it's less painful, it's less scar tissue. It's just a better, easier recovery than the old open surgery for sure.